Hello, my name is Amy Porath, and I'm the Director of Research at the Canadian Centre on Substance Use and Addiction, or the CCSA. I lead a team of multidisciplinary researchers whose work focuses on the impact that substances and substance use disorders have on Canada, on families living in Canada, the Canadian economy, as well as justice and law enforcement. We also work with policy specialists to inform the advice we give to all levels of government across the political spectrum. And we have a team of knowledge brokers to make sure the work we do reaches as many people as possible. For more than 3 decades, we have been building the trust in Canada that enables us to advance initiatives that reduce harms of substance use, improve wellness, and increase community safety. Knowledge and evidence are the foundation of what we do, and we actively support the creation of strong collaborative partnerships between researchers, health professionals, knowledge users, people with lived or living experience, and policymakers to help people living in Canada lead healthier and more productive lives. As much as CCSA is a credible voice and an established leader in the field of substance use and addiction, as a national organization, it has an equal responsibility to recognize and encourage the innovative work being done throughout Canada. And some of that innovative work is being done in Saskatchewan by Patrick Ognicon and the team at Saskatchewan Health Research Foundation. This year, SHRF Solutions program is focusing on addiction, and with very good reason. Before COVID-19 struck, Saskatoon Police Chief Troy Cooper told a colleague of mine that crystal meth is his #1 concern. And in many cases, the pandemic has only worsened the problem for people who use or have used substances. There has been a collision of COVID-19 and the opioid crisis. It has amplified the many issues that had existed in our fragmented system. The results from our recent Leger poll found that people with existing substance use and mental health concerns are being disproportionately impacted by the stresses related to the pandemic. More than 4 in 10 people with past or current substance use disorders reported drinking more alcohol since the pandemic started. They were also more likely to report having moderate to severe mental health symptoms, such as anxiety and depression, as compared to people with no history of substance use disorders. More recently, we found that while women were more likely to report mental health concerns, men were more likely to report problematic substance use. However, our data also showed that the pandemic is having a greater substance use impact on women living with younger kids who are under the age of 13, as compared to men who are living in similar households. We've also seen reduced access to a range of services and supports as a result of the pandemic, as well as reduced capacity in our substance use treatment programs. And these include harm reduction and treatment services, as well as other services offered by community health centers, shelters, and peer support programs. As much as we're seeing significant challenges for people who use substances, we're also seeing some unique and innovative responses to these challenges. The pandemic has increased the use of online and virtual care services, a major transformation that we thought would take another decade to bring about. Early results from our research into the experiences of those using virtual care services for substance use disorders, and concurrent disorders has shown that while 2/3 of those surveyed were satisfied with virtual care, less than half agreed that these services are as effective as in-person care. We also found in our work that there were many barriers that existed for people who are wanting to use virtual services and supports, with the biggest barriers being cost, lack of private space, and concerns with relationship building. And we also found that these barriers varied based on a person's age, gender, and race. We know there's more work that needs to be done to better understand how we can improve virtual care and the delivery of treatment services so that we can improve the overall experience for both clients as well as practitioners. Whenever we talk about substance use disorder or addiction, we have to remember that it is a medical condition, just like a heart condition, diabetes, or cancer. Addiction is not a moral failing or a choice. Research that produces knowledge that results in understanding and empathy can help people to get better. It can reduce harms, improve wellness, and community safety. And I believe that this is what the addictions focus of SHRF Solutions program is all about. At CCSA, we take seriously our role of collaborating with other Canadian scientists and organizations to advance their work and shine a light on the progress being made in every part of the country. Addiction is such a complex issue that no single organization or sector can tackle on its own. It requires the collective efforts of many partners, all of whom bring different perspectives and priorities to the table. That's why building strong collaborative partnerships between researchers, knowledge users, and policymakers is the cornerstone of this new solutions program funding competition. Bringing together multidisciplinary teams and multiple perspectives will help to ensure that the research projects are meeting the needs within the community. It will also help to ensure that their findings are effectively mobilized across different audiences in order to bring about change within the system. On behalf of CCSA, I would like to congratulate the Saskatchewan Health Research Foundation for launching this very timely and relevant funding program and investing in this important area of health research.